I'm honored, truly honored to be able to be here to represent my family, to show out, to welcome this new clinic location. It's really, truly an honor. Odessa Brown, she was a child advocate for quality health care with dignity, as well as affordable health care, especially in the underserved community in the Central District. And she was a fighter. She felt that every child deserved to be treated with dignity and health care, regardless of their ability to pay.
So what are we doing today? What are we doing today? In the simplest terms, we are building a stronger community for people often who have been underrepresented, undercounted, perhaps looking at the disparities in our communities, and we are working together to address it. Well, working with Odessa Brown and working with, I'm going to call Gene Emerson out just by name, and my wife, they're working out an effort called Reach Out Seattle, because we looked at our youth. Our youth are walking around traumatized, untreated, and this work that you are doing here at Odessa Brown with intervention, prevention, having those difficult conversations, looking at these children and understanding they are walking around with untreated trauma. When I go down to the streets on 3rd Avenue, I see people drugged out, unhealthy. There, but for the grace of God go I, because the people I grew up with are down there. So I tell you, community, I don't care how you identify, what you identify with, we're in this fight together.
So it's a little bit hard to be excited about this, but on the other hand, it's such important work. We're really lucky to be able to focus on behavioral health and mental health in this building. As most people know, we are in a crisis of youth mental health, and we have tried solutions for the last several decades, and we've never really been able to fully focus on that. And that's what this space allows us to do. We'll continue to offer integrated services. We'll continue to offer things like medical care and nutrition, but we really want to expand our reach to kids who have experienced trauma, to kids who are neurodivergent, to kids who have depression, anxiety, suicidality, who have interactions with the Child Protective Services, with juvenile detention, trafficking. I mean, the list goes on and on. It's really amazing to be able to have a space where we can meet some of the most vulnerable needs of our community and what we've heard from community that they want. So it's wonderful to be able to expand those services.
Well, I think it's symbolic of what we're trying to do here in Seattle, that we realize we have incredible growth, wealth, success. But it's all for naught if we're not taking care of our most vulnerable communities, those that have been disparately impacted in health outcomes, trauma, prevention, and intervention. And so I think this investment says, no, we don't forget about these communities, these Black and brown communities, these elderly communities. So it's a good day because people realize the importance of this kind of work, and I'm very proud to support it.
And I would love to be here along with all of you and ride that journey. Thank you.